So let's talk guidelines that you need to know for any medical certification exam. For ICD-10, do you know where to find your 6th and 7th character for laterality or, let's say, non-union of a displaced fracture? Let's say your exam question has these options, a bunch of S82s, and then you're going down to your 6th digit. They want to know what the 7th character is going to be. Where would you find it? For the exam, you're not going to come here to the individual codes and look up the 6th digit. If you're here looking up the answers, you're going to be in the wrong spot. Where you look for the answer is back here at our original code number for the first 3 digits, S82. Here's our 7th character list, and that's where it will always be. You won't go down to the 6th digit thinking that you're going to be able to find your 7th digit. Symptoms is another guideline that you should know about. Patient comes in for runny nose and a cough. Are you going to diagnose them with a cough diagnosis or a sinusitis diagnosis, or a common cold diagnosis, or are you going to code them with like acute sinusitis with a cough? Do you know when you can use this symptoms and when you can't? That will definitely be one of the questions asked on the exam. Do you know the diagnosis or the guideline tied to the diagnoses of acute and chronic diagnoses? Do you know if you can code them both on the same visit? Patient has a chronic condition, but it is acutely flared up today and they've had to be seen. Do you know if you can use those two on the same visit for the same day? And if you can, what order do you use those in? For that guideline, that's where this yellow line comes into play. Super convenient, and why it's there is if you have an acute and a chronic on the same indented line underneath a diagnosis code, then you can bill them on the same visit. If they're indented on separate lines, like chronic is on this non-yellow line, but then acute is on the yellow line, then you can't do it on the same day for the same visit. But for this example, that's exactly what you want to look for in your index. And if you can, acute always goes first for today's visit, and then chronic will be your secondary code for the day. First and second. A few other areas you should know is about burns. Be sure you know how to sequence those, that 3rd-degree burns are always first, and then you follow by your 2nd degree, and then you do your 1st degree last. As far as coding order goes for that day of the visit, you know you're going to have an OB one, somebody is pregnant, and you need to be able to code that. Be sure you know when to not bill the baby's info on the mother's delivery services. Also know that in situations where they might be in the ER for a fractured ankle, but they didn't have any injury and not being seen for an OB visit today, how do you sequence their pregnancy over what they're being seen for today if it's unrelated to the pregnancy? HIV. Be sure you know the guidelines about asymptomatic versus symptomatic. Be sure you know the guidelines about adverse effect, allergic reactions, things like that. If you do it to yourself, if you drink too much alcohol, if you take those mushrooms from your college buddy, do you know the guideline that the T code of the medicine or whatever substance it is goes first? So T code will go first. If a doctor does it to you, the MD prescribes you a medication that your heart stops or you have an anaphylactic reaction to, develop a rash, slow heartbeat, do you know that the symptom code goes first, the R code? Knowing that difference right here for any medical coding certification exam will definitely help you out a whole bunch in getting some of those guideline questions correct. Be sure you know which Z codes, as in zebra, can be primary or the very first diagnosis code. Be sure you know where the exceptions are and where the list is that you can find, noting which ones can be primary so that you can run to it during a middle of an exam. Super helpful to know where this list is at. And injuries, external causes. Be sure you have some sort of color coding, and we move these guidelines to the codes that are affected so you can remember to keep them in order of how it was caused, the intent, place of service will be your third code, the activity is next, and then your status. I move this color coding to the indexes and color code the codes so they match up, so I can keep up with which one's first, which one's second, which one's last. Super helpful to do that. And I move it to actually chapter 19 and 20 also, so that I have it right here with the codes also that it affects. I hope this brief overview is super helpful. It's at least the most important ones. Of course, we've got some CKD, some renal stuff and hypertension that we need to worry about too, but these top 10 are super important and at least will give you some direction on where to start and make sure that you understand at least these guidelines for any medical coding exam. I hope this is helpful. I hope to see you during my lives. I like to teach 3 days a week for free, 2 hours here on TikTok. Speaking of TikTok, please be sure and use the Keep TikTok hashtag this week sometime. I'd hate to see this app go away. I do have content additionally on YouTube. Those are the 2 places that I post information on, and that nothing will change there. And I hope to see you during my live classes. Thank you.